Good morning. I'm Dr. Azza Silotry and I'm going to start my PowerTalk with a case study. For a young woman of 28 years, it all started with minor muscle spasm and backache. Soon, she was tired and fatigued all day. Not long after that, she started feeling low and depressed. On visiting a consultant or a physician, it was found that she was vitamin D deficient. Sounds familiar? Well, this could be you. According to a recent survey, out of 4 unsuspecting Indians, almost 3 could possibly be vitamin D deficient. What is this vitamin D? Vitamin D is a hormone compound that has been implicated in regulating several diseases like cardiovascular disease, osteoporosis, diabetes, etc. There are 2 forms of vitamin D which are biologically active: vitamin D2, which is ergocalciferol, which is derived from plant source, and vitamin D3, cholecalciferol, derived from animal source. Natural food products such as mushrooms, liver, fish, etc. have very minute levels of this vitamin. So if not from diet, where do you derive this vitamin from? Well, humans synthesize vitamin D in their skin when exposed to UVB rays. However, because of certain conditions, for example, working indoors, wearing covered clothing, and not getting exposed enough to sunlight, etc., could reduce the level of vitamin D synthesized in human body. Also, in case of Indian population, we are brown colored, we have more melanin, and hence again, vitamin D synthesis is very, very low. When I say low, how is this low measured? Well, for measurement, what you do is quantify the vitamin D levels in the form of 25-hydroxy vitamin D in your serum. Levels between 20 to 30 nanograms per ml, that means a person is insufficient in vitamin D levels. Less than 20 nanograms per ml means the person is deficient, and less than 10 nanograms means severely deficient. The recommended daily allowance of this micronutrient, according to Indian Council of Medical Research, that is ICMR, is 10 micrograms, which is underquoted and needs revision. So, food fortification is an ideal strategy that is used by a lot of countries to achieve optimum levels of these vitamins. Before we get into food fortification, we need to understand the chemistry of vitamin D molecule as well as the food matrix or matrices chemistry. Vitamin D is a fat-soluble vitamin that is highly unstable and sensitive to oxygen and changes in temperature. There are few products in the market, for example, orange juice that has been fortified by vitamin D, which means vitamin D is in the aqueous form. I just told you that vitamin D actually is a non-polar or a fat-soluble substance. So the ideal candidates for vitamin D fortification would be ghee or butter, then milk and vegetable oil, which are consumed on a daily basis. Many countries like Canada, Sweden, etc. have mandatory requirements for fortification with vitamin D. In India, FSSAI has made excellent programs, roadmaps with the help of food fortification programs which are publicly funded, and also open market channels to achieve the desired level of vitamin D in Indian population. At our end, we have to emphasize the importance of prompt diagnosis and research on fortified food products that are locally available so that we can achieve the desired level and make India disease-free. Thank you.